Arimidex is a drug used to decrease the amount of estrogen the body makes, which slows cancers that need estrogen to grow. But the problem is that it is expensive, and some women have had to take a cheaper, less effective drug. And tonight's Focus for the Cure, finally, some good news for the women who take the drug.
Marion Bushman was thrilled to learn that the drug she uses to prevent cancer has finally become more affordable. For the past several months, Marion has been struggling to pay for Arimidex, an anti-estrogen drug her doctor prescribed to help avoid a recurrence of her breast cancer. It's expensive and can cost upwards of $1,500 for a 3-month supply. That's hard on a fixed income.
At the beginning, it was almost $300.
Arimidex is an anti-estrogen that's used to treat postmenopausal women with estrogen-positive breast cancer to prevent reoccurrence of their breast cancer.
Some patients have to choose between taking the drug or taking tamoxifen, a cheaper but less effective drug. On a daily basis, Dr. Raymond has this discussion with patients.
It's a tough decision when you're putting food on the table for your family versus getting the best drug for your breast cancer. It's a horrible decision.
Arimidex is in a class of drugs called aromatase inhibitors, and up until about 3 or 4 months ago, the aromatase inhibitors were only available in brand name.
And so when Arimidex went generic about 3 or 4 months ago, it substantially dropped the price by about 1/3 of what it was costing before.
For many people like Marion, it's a godsend.
Well, I was overwhelmed because I'm saving over $400 a year. It was beginning to be a strain.
Marion and her husband have a good use for the money.
That money can be for pleasures, for giving gifts to my grandchildren, my great-grandchildren, and just make life a little easier.
If you would like more information on this story, please contact the Susan G. Komen for the Cure helpline, 561-514-3020.